So I'm Jan Purser. I'm the naturopathic nutritionist at Remedy Wellness Medicine, which is a great practice in Mosman Park in WA. I've been working here this will be my 13th year, but I've been in practice since the late 1990s. Let's think about that. So I've been in practice for over 20 years. And what I've been doing more recently is focusing a lot on cognitive health.
So tell us a little bit more about what a naturopath does and what training you do, what study that you've undertaken.
Mm-hmm. So when I first studied, the requirements for education was of a diploma course. So I did my naturopathic nutrition first. And so I have a diploma in that from back in 1990s. And then I went on to do my advanced diploma in herbal medicine, Western herbal medicine and advanced nutritional medicine and naturopathy. So all of that combined. Well, I think to call yourself a naturopath, you have to have the qualifications. So if it's people more who studied naturopathy around the time I did, then they're more likely to have a diploma or an advanced diploma. And some people might have also gone on to have a degree. But the current naturopaths coming out and for the last, or at least 10 years or so, I think they would all have degrees. So you can't call yourself a naturopath unless you have those, qualifications.
Yeah. What was it that initially led you to going down that path?
So that's a good question. When I used to be a food editor at the Australian Women's Weekly Test Kitchen, and I was having health problems and really chronic problems, actually from, in my late teens. And I went to see a naturopath and he put me onto a regime of care. And I was so much healthier then from following his instructions and diet guidance and so forth and herbal medicine. And it just made me feel really inspired. And I think at the time I was a bit disillusioned with the kinds of recipe focus that we were doing at the test kitchen. I wanted more health focus. I was kind of obviously leaning towards that way. So that's when I started studying. There's so much conflicting advice and, good old Dr. Google can lead you down all kinds of alleyways that might not be suitable for you. And I think just trying to sift through that and know what's the kind of information you should look at or would be most suited to you individually is quite tricky. I guess that's where seeing, somebody who's has the qualifications and the experience would be quite helpful.
So what sort of patients do you typically tend to see in your practice?
Right, well, more recently, over the last going on 5 years now, I think it's actually going on 6 years, I've been focusing a lot on cognitive health and Alzheimer's prevention. I actually have done some extra training. It just occurred to me I've done the RECODE training. That's through the Dale Bredesen in the United States. So originally I did training in 2017 through him and the Institute of Functional Medicine in the US. And then just last year I've completed the upgrade training, if you like, of RECODE 2.0. And I spent most of the year, doing that study to upgrade. So just because of that and because of my area of real interest, which is cognitive health, I've been seeing a lot of people who wish to prevent Alzheimer's and dementia, or people who have been diagnosed with it, Or, I've been contacted by the family of people who've been diagnosed with it and they're wanting to bring their loved one to me for some sort of help.
And tell us a little bit more about the steps that you go through and the kind of treatment pathways that you follow.
I'll probably go back a little step and just say it's always so much easier to prevent Alzheimer's and dementia. So my ideal patient would be somebody who's trying to prevent that, whose mother or father has had it and they're really wanting to know, well, what can I do? And then I guess my next favourite would be somebody who's very newly diagnosed, so not too advanced. And so the steps that I would go through would be organising various tests to determine what are the drivers of the Alzheimer's or the cognitive decline. And there's, a handful of drivers such as inflammation, toxicity, nutritional deficiency, some type of trauma. Also, when I say trauma, obviously head trauma. And then managing blood glucose and insulin, so that underlying tendency towards diabetes type 2 risk. So that would be something that I'd be looking at as well. So those tests can include, pathology tests where I might request that the patient go and talk to their GP, so I'd send them back to the GP. And then other tests might be functional medicine tests, so they would include various things like hair tissue mineral analysis, tests to determine genetic susceptibility, and that can be a whole range of things that can show. There would be other tests, let's say if somebody's been diagnosed and they've been exposed to mold, we might be looking at mycotoxins, which is the byproduct of mold infection in the body. In short, it depends on the person's history and also, other contributing factors that I might gain from getting their history and background, and I'd work out what tests that they need to do based on that. I think the perfect scenario is when the GP and the complementary medicine practitioner, such as myself, can work as a team to assisting the patient with their health goals, if you like. So now, for example, I might send the patient back to the GP with a blood test request, just asking could they possibly refer for blood tests.
Yeah.
But I always, discuss with my patients that the GPs can't usually request all those blood tests because of the Medicare rules and so forth. And so the tests that can't be done by the GP, I can actually refer for the patient, but it just means the patient would have to then pay for those tests.
Yes.
And so I would also refer to other practitioners, like an osteopath or a chiropractor. I'll refer to them. I refer to a nurse practitioner for bioidentical hormone assessment if the person is deficient in hormones. So it's terrific to work, as a team, just trying to optimise the patient's health. The way I look at it is, we've all got our toolbox and we have different things in our toolbox that we can help, with our patients. And that's where...
Nobody knows everything.
No, I don't know everything, I see a lot of people for weight loss.
Yes.
I really love working on weight loss and weight management. Also, I see children, so children with behavioural problems, ADHD, and adults with ADHD, autism.
Okay.
So I have, patients from their mid-20s with autism to small children. So I guess I've always had that leaning towards head and cognitive function and So with autism and ADHD, they're all on the spectrum, as they call them. And so I would be looking at, again, what the drivers are. So what are the drivers that have caused this sort of inflammatory process that occurs in the brain, or imbalance of neurotransmitters? And so I'd start with gut health, and I would also then be looking at, particularly with children, doing an organic acids test is a terrific urine test, so it's not difficult for kids to do. And it gives you a good idea of how their various body systems are working and if they have nutrient deficiencies. And then based on that, I quite often organise a personalised prescription for compounded nutritionals, which the chemist can then make up, specific for that child, so that they're getting the actual nutrients that they need. Obviously looking at diet and the other things that can affect that whole, the way that the brain is functioning for those people. What I'm particularly interested in is a number of adults that are being diagnosed with ADHD or ADD. And I think because it's so much more accepted now to talk about it, and also there's more information about it, and I think people kind of see the list and go, this is me, I've been struggling with this for years.
Yeah.
And, I have heard some people say that just having that diagnosis, this is adults, what a relief it was to have that, because they'd really struggled with various aspects of that through their lives.
Yeah.
And, some have had medication, and it's really helped change their life in a big way. One of the things that any practitioner has to do is to know what the patient's taking. And, from my point of view, if I'm prescribing herbal medicine or nutritionals, is really making sure that none of that is going to contraindicate with their medication, and really just want it to support it as much as possible. Yeah, well, I hope it continues to grow and improve, and so that, we can all work together for our patients.